This epidemic of opioid use and unfortunately overdoses, has a devastating impact on our communities. We have about 500 people every year who die from an opioid overdose. That's what we typically think of as heroin, Vicodin, oxycodone. All can lead to some very tragic consequences.
It is not just a law enforcement problem, it is a societal problem, and we all need to work on it together. We've seen what's coming our way, and we prepared for that. In 2017, we started issuing Narcan or naloxone, an antidote to an opioid overdose, to our staff throughout the organization, first as a pilot program and then more formally. Year to date, we have rescued 43 people after 45 applications of it. So we've been very fortunate that it has worked effectively in the vast majority of cases we've used it. We're not in the medical providing field. We are first responders, and we're there oftentimes, come across somebody who's down, potentially an overdose victim, and we know that we want to get paramedics out there, the people who are best trained to deal with this. But we also know that if we wait for that response, potentially it's going to be too late by the time that unit gets there. So we want to be able to have the tools on us to be able to treat the person and give them a much greater chance of success.
So often patients, where they first come to realize their addiction and their need for services is at the point of an emergency. They present to an emergency department with an overdose, they present to the emergency department in withdrawal, and they realize that they need help. They realize that they have an addiction, and they realize that they can't overcome that addiction by themselves alone, and they need help. And emergency departments within DHS, here at LAC USC, and also at Olive View UCLA Medical Center, at Harbor UCLA Medical Center, are here for those patients. We're here to connect them to services and to start the prescriptions and the medicines that are needed to help treat them and make sure that they're well cared for moving forward.
Los Angeles County is implementing a new program here where my office and public health, the county's health officer, will send a letter to prescribers letting them know that their patient died of an opioid overdose. It is extremely important for us to make sure, one, that physicians, first of all, know that their patient died. That's I think, just an important thing to do. The other is to give them the opportunity to change what they do professionally based on information they may not know about. So if they do not know that the patient died of an opioid overdose, then they won't have a reason necessarily to change their prescribing behaviors.
The most important thing for people to know is that there is help and that it's a call away. So we have a 24-hour call line, 1-844-804-7500. 24 hours a day, we have folks there that are trained and can help connect you to specialized services and support for you and your loved ones.
My ask of you is that you become knowledgeable, you become aware of the problem, and you talk about it. Talk to our young people, talk to friends and relatives. Everybody has another group of people that they can impact. If we don't know about stuff, we're going to put ourselves in a position where we could potentially become a victim. So let's educate each other, let's look out for each other, and do the very best we can to be able to deal with this, our latest issue.